How do you know when your treatment with Accutane is complete and it's time to stop and conclude your treatment? That's the question that we're going to address today. Welcome, I'm Dr. Arthur Kolsky. I'm the founder and medical director of Advanced Acne Institute. We're a dermatology practice that only treats acne. So we focus only on the treatment of acne, and we like to discuss some of the things that we hear from our patients about acne and acne treatment and their struggles with acne and their pathway toward clear skin. And we hope that other acne sufferers who are listening find some of this information useful and helpful on their pathway toward clear skin. Now, this is not meant to be medical advice. This is just for educational purposes only. So the question that I posed today is, how do you know when it's time to conclude your treatment with Accutane? So this is something that I've discussed in the past in various ways in other segments, but I keep hearing this from my patients. They want to know, when can they stop? What are the signals that say that they can now conclude safely and effectively, and when they don't have to take Accutane anymore? So the answer is not completely definitive. And that's why people continue to have this question, because there is no definitive answer to that question. So the reality is that there are some guidelines that we use. And if we follow those guidelines, we can generally feel that we've had an optimized treatment and that the likelihood that acne is going to come back is low, although we can never guarantee that acne will not come back, even with Accutane. So there is a percentage of patients that have acne coming back. They experience a relapse of their breakouts. And we don't really know who that might be. We don't know how to predict which patient is going to be the one or the ones that have a relapse of acne. Now, what we do know is that if we look at the literature and we look at the studies, we get a general idea, a good consensus or some guidelines that help us to try and mitigate or lessen the likelihood that acne will come back once we conclude our treatment. So what do the data show? Well, the data show that if we stop too soon, there's a much more higher risk of acne coming back, of a patient experiencing a relapse of their acne breakouts. So we try not to stop too soon. So what does that mean? What is too soon? Well, there are a couple of parameters that we like to strive for. For example, one of them is we like to reach what we call a cumulative dose. And that means that while you're taking Accutane for acne, if you get to a certain level, we add up all of the milligrams that you take, that a patient takes. And if we add up all of the milligrams and we get to a certain number, and we use that number in the context of each patient's weight in kilograms, then we come up with a number. And that number helps inform us if the patient has reached a sufficient amount of treatment. Now, that number is not set in stone. So if you look at the data and you look at the studies, that number tends to move a little bit as we learn more about Accutane treatment and how to optimize a patient's experience with Accutane. Now, even though Accutane has been around a long time, since 1982, you would think that we would have that already worked out, but we don't. Because as time goes by, we learn more and more about this medicine. Even though we have a lot of information and we have a lot of experience using it, as time goes by, doctors learn more and more about expectations and how to optimize treatments and what dose to use and how long and what's the duration of treatment. We keep learning this information as more and more patients are treated. So we don't really have a fix on what is exactly the right dose. And the truth is, it can be different for each patient. So it doesn't mean that every single patient has to comply with the same cumulative dose to get the same optimized treatment. There are some patients who take Accutane for a very short period of time and then they don't have acne flaring up again. Their acne is in remission for a long, long time, maybe for good. And then there are some patients who take Accutane once, twice, 3 times for long periods of time, and they still get a relapse. And so this all has to do with our own genetic composition. Each of us has a different susceptibility to Accutane and to acne, and which one of us is going to have a relapse and which one of us is going to respond well and which one is going to respond not so well, we don't know. And so we have to assess each patient and do the best we can with each patient. And we observe and we try to use signals and we try to get the best information that we can to help each patient achieve that status of fully treated and in long-term remission. Now, another thing that we like to see is that a patient is clear before we stop treatment. So we don't want to have a patient who's still breaking out and then we conclude their treatment, because that for sure is a recipe that they're probably going to have more breakouts and relapse again. And we like to give a buffer. So if a patient is clear for 2 or 3 months while he's or she's on treatment, that gives us a pretty good indication that we are optimizing that treatment. It still doesn't mean that they're not going to have a flare up and break out again, but it gives us more reassurance that we are in the right trajectory to having them obtain clear skin for a long period of time, for a long-term remission. So those are 2 factors that we use. Now, there are patients who have other mitigating circumstances. Some of them are taking hormone replacement. Some of them have hormone abnormalities. And these patients, they tend to have a higher risk of relapse, even when we give them an optimized treatment and we do everything we can. And sometimes in some patients, we need to treat them for a longer period of time. And it doesn't mean they have to be on a high dose for a long period of time. Sometimes we taper downward when we're at the point of concluding treatment, and we slowly go downward, and then we get to a low dose. And sometimes we stop then, or sometimes we continue on a very low dose for a longer period of time. And a low dose can have a lot of meaning. For example, it could be a certain milligram every day, or it could be taking Accutane only, for example, twice per week. There are a lot of ways to create a regimen for each given patient depending on their particular circumstances. So it's not a one-size-fits-all treatment. I've said this many times, and I continue to say that. Accutane is not a one-size-fits-all treatment, and you have to work with your doctor, and you have to make sure that everybody's watching closely what's happening, and that if there are signs that things are not getting better, maybe something else is afoot, maybe you need certain things evaluated, maybe you need a higher dose, maybe you need a longer term treatment. There are many, many circumstances that might be important for each given patient. And remember, this information is not geared toward any particular recommendation. It's just geared toward information because each patient is different and each patient needs to address these questions and this circumstance with their own medical provider to make sure that they get a treatment that's right for them, safe for them, and most optimized for them. So that's kind of the message of today's video, that it's important to understand that there is no one-size-fits-all. There is no particular point when you can stop treatment because now you've had the full treatment. We don't know that information. Every patient is different. Every doctor and patient need to work together to make sure that the treatment is optimized for that patient and that patient's circumstance. And then we can give them the best optimized treatment. However, that still doesn't mean that there's not going to be a relapse. Everybody is at risk of that. There could be a change in life circumstances. A given patient might be under more stress at a given period of time, and that may lead to a relapse, or a patient may start to use skincare that's acne causing, and that may lead to a relapse. A patient may take other medications that are causes of acne, and that may lead to a relapse. So there are so many different reasons why a patient might sustain a relapse later on after Accutane treatment. So it's a very fluid circumstance, and we always have to be on our toes, watching and monitoring closely and making sure that we do the best we can to try and ensure that a patient is going to have the best chance of having a long-term remission of their acne.